Tuloy po ang pagkikisa ng Pilipinas sa iba't ibang clinical trials sa buong mundo para mahanap ang tamang bakuna para sa COVID-19 at karamihan sa mga trials na ito ay inaasahan magaganap ngayong buwan dito sa bansa. Isa na dito ang Solidarity Clinical Trial na pangunahan ng World Health Organization. Makakapanayam natin si Dr. Abeyasinghe, ang WHO representative in the Philippines. Good morning, Dr. Rabi. Welcome back to the public briefing.
Good morning, Secretary Handa. Pleasure to be here.
Dr. Rabi, when exactly can we expect the Solidarity clinical trial for COVID-19 vaccine to start in the Philippines? How soon is soon?
We are very eager to start the trials as early as possible. We acknowledge that the process has not been as we planned. We were planning to start the trials as early as October, the beginning of October. But right now we are looking at starting the trials towards the end of October, and that is a complicated process. We have shared the protocol with the government of Philippines. I believe the Philippine government's partner in this effort for the vaccine trials is the Department of Science and Technology. So what we need is for the DOST and the principal investigators to approve the protocol and get the necessary regulatory and ethical clearances in the Philippines, and ensure that the requirements for readiness are met. And there are 8 criteria where we look for readiness. Once those are ready, we believe that parallelly the selection of the candidate vaccines for the Solidarity trials will be finalized, and WHO will be in a position to send the candidate vaccines to the Philippines for the start of the trials. And we are still hoping that the Solidarity vaccine trials, which are phase 3 clinical trials, could hopefully commence by the end of October.
What exactly would be done on the dry run within this week?
That's being coordinated by the DOST and the DOH. So that question will need to be asked by them. WHO is helping with an assessment of the preparedness and readiness for the introduction of the vaccines, and we are hoping that that process will be completed in time for the arrival of the vaccines. But we are still waiting for formal ethical and regulatory clearance from the Philippine government authorities so that we can start with the deployment of vaccines. However, I need to emphasize again that WHO is in the process of finalizing the candidate vaccines that will be used for the Solidarity trials. What is good about the Solidarity trials is that it's a rolling mechanism. So as vaccines that potentially meet the requirements become available, they could be included in the trials even at a later date.
What specific vaccines will be used for this trial, and how many? Have they already been identified and approved by the Department of Health and other agencies concerned, Dr. Rabi?
Unfortunately, WHO is still in the process of finalizing which vaccines will be included in the Solidarity trial. We are now looking at 42 vials, products that are in clinical, late-stage clinical trials. Of those, about 8 or 9 are close to meeting the requirements. WHO is working with the respective manufacturers to finalize which will be the final list that will be included in the Solidarity protocols. That list is not final at this point of time. So we are not yet clear which vaccines will be included for the Philippines.
Dr. Rabi, have we also identified how many individuals are required to participate in the trials?
For the Philippines, WHO was hoping that the Philippines will include up to 4,000 individuals. The Philippines has identified 10 vaccine trial sites, 9 of them in the National Capital Region and 1 in Cebu. The idea is that there needs to be some level of COVID-19 transmission to measure the efficacy of the vaccines. But we've seen a decline in transmission rates in both Cebu and NCR. But we believe that the current levels of transmission are still adequate to trial the vaccines. However, that decision will be made once we have the candidate vaccines to come in.
Since the participants will be identified on a voluntary basis, are there volunteer participants and trials, and what is the information that you have, Dr. Rabi, with regard to that?
So on the number of participants, WHO was hoping that there will be up to 4,000 participants from the Philippines. Our understanding now is that the Philippines is looking at 2,000 to 3,000 participants joining the trial. We are hoping that that number could be increased because the larger the number of people we trial, the sooner we could get evidence of efficacy, safety, etc. The protocol that WHO has currently looks at volunteers between the ages of 18 and 60 years who will be included in the trial. Of course, there are some exclusion criteria, people having comorbidities, or especially people, pregnant ladies, etc., will not be included in the trial. Simply because we are evaluating the safety of the product at this point of time.
You mentioned evaluating the safety. Is there a way to ensure the participants of their safety? Will they be monitored individually and diligently?
That's what is expected of the Philippine counterparts, to do that monitoring on a weekly basis at a minimum, and follow up the recipients of the vaccine on a weekly basis at a minimum, so that any side effects, however small or minor, may be picked up early enough and reported. So this is what is expected as the contribution from the Philippine participant authorities who will be joining the trial. Of course, the solidarity trials are multi-country, multi-center trials. And the purpose is that it will help us to include a large number of patients. We are looking at up to 60,000 patients who could be included, so that we can have the evidence of efficacy and safety early in the phase 3 trials.
In September, the DOST, or Department of Science and Technology, earmarked a total budget of 89 million pesos for the Solidarity Trial, as confirmed by the Department of Health. May we ask Dr. Rabi why a budget as this is necessary for the trial?
Let's be clear that the allocation made by the DOST is for the coordination of local efforts and for local expenditures. WHO takes the responsibility of shipping the vaccines to the country, providing the vaccines free of charge, and ensuring that any insurance for recipients are provided so that they are well looked after. Most of the expenditure earmarked by DOST is for logistical reasons, for management of the protocols, and for follow-up of recipients, and ensuring that the trials go according to plan in the country.
Let's proceed to the media questions for Dr. Rabi. Yusek Raki.
Okay, thank you, Secretary Martin. Good morning, Dr. Rabi. Questions from Red Mendoza of Manila Times. Two WHO experts. Good morning, sir. Two WHO experts, Mike Ryan and David Navarro, have both said that there should be a stop on lockdowns as it destroys economies. This statement has been given wide media play and is now being used by the WHO's critics as proof that lockdowns do not really help in the situation. What is the WHO's official stand on the statements of the two officials?
Thank you, Yusek Raki. This is a very important question, and we like to really clarify this. We have not said that lockdowns have no place. We have been clear from the beginning of this pandemic. In fact, since April, both the DG, our regional director, and myself have clarified. We want this response to be not only a health, but an economic response as well. So we are as interested as mitigating the health impact and ensuring that the economy is not damaged and economic revival is ensured. For this, it is necessary that early detection of cases, prompt isolation of close contacts and positives, and quarantining of those, and appropriate contact tracing and proper management of cases is ensured. If these measures are in place, together with compliance with the public health behaviors and the avoidance of the 3 C's, we could avoid large-scale lockdowns. That's what we've been advocating for countries right from the beginning of this outbreak. We don't view lockdowns as the primary response. And if you look at very carefully what Dr. David Nabarro and Mike Ryan are saying, they're saying the same message. We don't view large lockdowns as the primary response. The primary response should be a public health response. And when this fails, when the health systems are being overwhelmed, it is necessary to use lockdowns as a last resort. That is what we have been advocating right from the beginning. The early lockdowns help the countries to expand their capacities and be better prepared to deal with surges in cases. That's why we are seeing low mortality in the Philippines. And we are seeing increased diagnostics because the diagnostic capacity was increased. But we have not at any stage advocated that large-scale lockdown should be the primary response. This is very clear. So there is no actual flip or change in our position. We have always been advocating the same position.
Yes, Dr. Rabi, the WHO has announced that some low and middle income countries will receive antigen test kits funded by the Gates Foundation. Is the Philippines one of those countries who will receive those kits?
Thank you again, Yusek Raki, for the question. The question is important because there are many countries that still don't have capacity for RT-PCR testing. WHO has been clear that the antigen tests have significant limitations. Their capacity is limited to detecting patients with high viral loads in the upper respiratory tract. So using antigen tests will mean that a significant proportion of positive cases are missed, but this is a measure that will help low and middle income countries that don't have capacity for RT-PCR to have some kind of diagnostics. That is why WHO is advocating for those countries to use antigen tests in the absence of capacity for RT-PCR and not as a replacement for RT-PCR. I hope that is clear.
Questions from Christine Sambilio of ABS-CBN. What can the WHO say about the fact that the Philippines is now in the top 20 countries with the most number of COVID-19 cases and that our positivity rate is still above the 5% benchmark of the WHO, this despite a reported declining trend in the number of cases?
So, the number of cases reported in a country is dependent on its population size and its capacity to detect. So if you look at the Philippines has, from a population perspective, I believe the 12th or the 13th largest population among countries in the world. and from a testing capacity, a significant higher testing capacity than many other countries in this part of the region. So if you look at it, the fact that the Philippines is reporting a large number of cases and is listed as the 20th country with the most number of cases does not actually translate to high incidence at a population rate. So we have to be careful in interpreting data and not pick and jump to wrong conclusions. This is critically important. You have to look at it from a comprehensive perspective. What capacity do we have? How good are we at reporting? And what is the population rate of infections we are seeing? And in this respect, the Philippines has a significantly higher population testing rate than many other countries, and equally importantly, a much lower proportion of fatal cases than many other countries in the region.
What is your recommendation for the Philippines to improve its COVID response?
Again, I want to sound, I don't want to repeat the same message, but it is largely the same message. We need to ensure that we have consistent messaging from the government, from the media, from the private sector, recognizing the importance of the three key public health behaviors that WHO has been advocating right from the beginning of this pandemic: hand hygiene, respiratory etiquette, physical distancing. Couple these three key public health behaviors with the avoidance of the three C's. Avoid crowded, congested, closed places so that you minimize your risk of infection. And as we recognize the need to bring back the economy, we need to carefully calibrate these measures so that we don't allow for a significant increase in transmission again, as we've seen in many other countries now in Europe and North America, who relaxed completely their compliance with the measures and are now experiencing again a significant surge and a need for large-scale lockdowns. The secret of success is to balance these measures and ensure a smooth and gradual opening of the economy while controlling the pandemic till we have effective vaccines and therapies at our disposal.
Dr. Rabi, question from Marichu Villanueva of Philippine Star. Can you clarify, Dr. Rabi, which does WHO protect, the volunteer participants of a solidarity test or the COVID-19 vaccine being tested?
Sorry, can you repeat that question?
From Marichu Villanueva of Philippine Star, her question: can you clarify, Dr. Rabi, which does WHO protect, the volunteer participants of solidarity test or the COVID-19 vaccine being tested?
We are interested in the patient welfare. So if the vaccine is being tested on volunteers, our focus will be on protecting them. We want transparent sharing of information. That's why we are advocating that the vaccine trials are multi-center, multi-country, so that there is open access and sharing of information about the actual efficacy and safety profile of the products. And our core mandate is to protect the health of people, and we have not changed that up to date.
Question from Joseph Morong of GMA7. How far along is the WHO as far as the solidarity trial is concerned? Any vaccine that is emerging to be a front runner to be used in the global tests?
That's a good question. There are, I believe, 2 or 3 candidate vaccines that are being reviewed very closely. But as I already mentioned, no final decision has been made. And in the absence of that decision, I am unable to mention which vaccines have been shortlisted or selected. I appreciate your understanding.
What is your comment on the Philippines being number 18 with most cases in the world? Does it mean that the strategy against COVID is not effective?
By number of cases, you may be number 18, or I believe it's number 20. I'm not quite sure. But if you look at the and that number of cases is a reflection of how much you are testing. But the key issue is how many people are dying, and if you look at from the proportion of fatal cases, I believe that the Philippine response has been very proactive and very good in controlling this pandemic. Of course, it is still early. We need to ensure that we comply with all of the protocols that we've been following and ensure that we continue with that process, because if we tend to relax and become complacent, we run the risk of having another surge of cases. And as we haven't really zeroed and flattened the cases, we need to continue to stay vigilant and continue to increase our preparedness and response capacities, not only here in the National Capital Region and Metro Manila, but even beyond in other provinces where we are seeing small upsurges in cases now.
Dr. Rabi, question from Evelyn Quiroz of Filipino Mirror. Polio is a disease which can easily be prevented by vaccination. For the first time after 19 years, polio has re-emerged in the country. Is this an indication of the failure of the Department of Health's vaccination program?
That's a complex question that actually has about 4 or 5 questions in that. One of the reasons we view why we had a resurgence of polio cases is because of poor vaccination coverage, and that has been influenced by many factors, not only the responsibility of the Department of Health. There have been concerns about vaccine hesitancy and vaccine safety, not related to polio, which have, we know, adversely impacted the uptake of expanded program of immunization vaccines or childhood vaccines, not only the polio vaccine. And so it is critically important that we act early to bring back the vaccination coverage. We know that the poor vaccination coverage also resulted in a large measles outbreak in the Philippines in 2018-19. So recognizing this, WHO is now working together with DOH, UNICEF, Rotary International and other partners in the polio response. That response has now been completed on the Mindanao Islands in NCR, Region 3 and 4A. And we are embarking on doing the remaining areas of Luzon and Visayas starting on the 26th of this month. And also we want to support the DOH in its supplementary immunization for measles and rubella in anticipation of a possible large-scale outbreak, because we know that EPI vaccine coverage has suffered also as a result of the COVID pandemic. So we want to increase the immune levels in the young children and protect them so that we don't have a repeat of large outbreaks of polio, measles and rubella.
Okay, Dr. Rabi, question from Joseph Morong again of GMA 7 with regard to COVAX. How soon can have a vaccine you think that can be for a distribution?
The COVAX initiative is to ensure that the vaccines are universally accessible to all, and that we meet the principles that have been identified by the Strategic Advisory Group on Immunization of WHO. We have 6 principles that have been clearly defined by the SAGE for COVID vaccines. And the COVAX mechanism is a mechanism to ensure that, given the fact that the vaccine trials are undergoing, phase 3 trials are only about to commence large scale during this month or later, we don't expect a vaccine to be available for population deployment before the middle of next year. So at the earliest, maybe June next year.
Thank you, Undersecretary Rocky. Lastly, Dr. Rabi, your message for the Filipinos who are continuously facing and battling this pandemic.
From the beginning, we have been giving one message. This needs to be a comprehensive, coordinated message across government, different levels of government, across private sector, and across the community. We need to work together. We need to work together to ensure that there is compliance with the basic public health behaviors that we have mentioned. We need to ensure that the physical distancing is maintained. This is critical to interrupt the transmission of the virus. And we need to ensure that we make every effort to protect the most vulnerable, dearly beloved elderlies, and people suffering from comorbidities. We have to continue to work together, and the message that we are tired, we want to go back to life as we knew it before. I think we have to park that for a time being and keep working so that we ensure that everybody is protected until we have good protection for everybody and we can go back to life as we knew it before. This is the new normal. We have to recognize that these behaviors are critical and important in this time, and that we maintain all of those behaviors to ensure that our efforts at protecting the most vulnerable continue to give fruit while we ensure that the economy gradually opens up and we minimize the suffering brought about by economic hardships for people in the most vulnerable categories. Thank you.
We are all hoping for the positive outcome of the Solidarity trial. Thank you so much for your time, Dr. Rabi. Abeyasinghe from the World Health Organization.
Thank you, Secretary Handa. Pleasure to be here. Have a good day.